this evening. Just before we do that, I just thought I'd give you the key highlights of the clinical strategy. And in looking at our clinical strategy, we've really shaped our clinical strategy to address what we know to be the key healthcare challenges, not just within North West London, but more broadly across the UK. And there are four sort of key planks to that strategy. The first is about creating more local and integrated services. So the aim there is to really keep people healthier and healthier at home. And that's especially important as we know we've got a growing population and a population that is ageing, and many of those people have long-term chronic conditions that they are needing to manage. The second key plank is about concentrating specialist services where it's necessary, and where it's necessary is to make sure that we continue to improve the quality and the safety of those specialist services. The third key plank is ensuring that we better organise our care, and not just around our hospital facilities, but really around our patients' needs, to really improve the patient experience and to ensure the best clinical outcomes. And then the fourth plank is about delivering more personalised medicine, and that's particularly important to be able to capitalise on the advances in genetics. Our strategy is obviously also guided by the broader strategy within North West London, which is Shaping a Healthier Future, developed by our commissioners.
Rubbish.
Each of our services is really organised around our three key sites going forward. And if we could just have the next slide, thank you. Each of those sites has quite a distinctive and interdependent focus. So for Charing Cross, we will be developing a local hospital which will really deliver innovative services, both day case services, diagnostic services, outpatient services, therapies and day surgery. Our Hammersmith Hospital will continue to develop as a world-leading specialist centre and will continue to be co-located with the Queen Charlotte and Chelsea Hospital, which delivers neonatal and obstetric and gynaecological services. And then our St Mary's Hospital site will continue to develop as the major acute centre for North West London, and we will be relocating the Western Eye Hospital to be co-located on the St Mary's site. All of our hospitals will continue to provide outpatient care for a wide range of specialties, so that when you need to go to one of our hospitals for a particular procedure, that will be the exception. In the majority of cases, you'll be able to attend your nearest hospital to receive local services in the outpatient and community setting. Now I'd like to introduce the first of the two case studies for the new types of services that we have been developing in North West London. And the first of those, and do we have our two speakers? Right, they're hiding behind the screen. So if I could introduce our first two speakers, Dr. Sarah Bryce, who is one of our consultant geriatricians, and Penny Marwood, who's the lead for the Community Independent Service for Hammersmith